Welcome. My name is Brent Murphy. I'm the president of RTU. I'm going to discuss our bachelor's degree in medical imaging with an emphasis on MRI. RTU is a nationally accredited university. We offer bachelor's degrees and master's degrees in the radiological sciences. Our medical imaging degree is an AS to BS degree. We have 4 options. We have CT, MRI, nuclear medicine / PET, and ultrasound. Today we're just going to focus on MRI. Some of the program highlights of RTU and the programs that we offer in the medical imaging. RTU is nationally accredited. We offer a blended learning environment as we deliver these bachelor's and master's level degrees in the radiological sciences. As noted, the medical imaging degree is an AS to BS degree. The blended learning environment is also called a hybrid learning environment that capitalizes on combining online virtual training with on-site boot camps, hands-on type training. The retention for the students is through the roof. It's much better than just one or the other by themselves. You can finish the program in 16 months, okay? You can slot a program plan of study for 2 years, 3 years, or as fast as 16 months. Our faculty are clinically oriented. Financial aid options are available. So what makes RTU different than the other programs? Our faculty are clinically oriented. They're in the trenches, okay? They're up to date on the modern technologies and where the future of it's going. In addition to being able to communicate the didactic foundation so you understand as you're doing an application, as you're doing a procedure, what really is happening and how you can make that procedure better. So we tie the didactic to the clinical process. That's what makes it different. We network heavily. We're a family community. Our students are networked with our graduates. Our students are networked with our faculty. Our faculty are networked with our graduates. We're networked well with vendors. Okay, that's important as far as education and as far as employment. Modern day dynamic curriculum makes us different. We take that didactic information, the foundation, the fundamentals, and then we show you how that's applied to the current technologies. All right. We introduce the informatics and the benchmarking and the metrics that are now becoming requirements. And this is good so we can advance these technologies safely. Okay. We look at radiation safety for the ionizing programs. For the non-ionizing programs, we look at other safety items. Safety across the board in any medical imaging application is important. It's just not something that you read about. It's something that you actually do, you actually practice as a team. So we introduce concepts, all right, and practices to help the student and the graduate in those processes. For MRI, we spend a lot of time on the strong emphasis of the current technologies where hot items, hot topics may be. This may be body site oriented, okay? What are some new body sites that are gaining a lot of attention or new procedural aspects applied to certain body sites? Breast, for example, abdomen, for example, cardiac, GYN for MRI, MRI spectroscopy, molecular imaging side of the house, molecular imaging done with PET, molecular imaging done with MRI. Now there's systems that do both at once. This is amazing. Where's that going to take us? That's very exciting technology. That's stuff that you learn in our program. Interventional MRI. Anything on these imaging aspects, a combination of these imaging aspects to help us better serve the patients. MRI and IGRT, image-guided radiation therapy. As we treat cancer patients with radiation on the front side, we can do an MRI now. And that provides us the opportunity to do very precise setups. Using very precise setups, maybe we can give them more dose and kill more cancer and have a higher kill rate or survival rate. These are wonderful things. The current technologies, the modern day technologies, and the future technologies are tied into our didactic. We pretty much can sum up how we operate and what we believe in with our core values. Compassion, clinical compassion. We want compassionate people that are in the field for the right reason to help patients. We train you hard. We want you to be competent. Okay, you work with your peers, you work with your colleagues, you work with your graduates, you work with the faculty, you work with the TAs. We want you competent. With a competency that one gains comes confidence. With that confidence, it makes it a lot easier to communicate questions, answers, discussions, sharing ideas. It's a great cycle. Very passionate about what we're doing. The faculty, the graduates, the students. So we welcome you to learn more about RTU. Please visit our website at www.rtuvt.edu. Thank you.